Okay, perfect. Thank you all for joining us today. I will now turn it over to ASH Executive Director Laurent Hubert.
Thank you, Megan, and welcome and thank you everyone for joining us today for this webinar on tobacco industry interference and also the launch of the 2025 U.S. Tobacco Industry Lobbying Tracker. Today's webinar is hosted by ASH, the American Nonsmokers Rights Foundation, and the Campaign for Tobacco-Free Kids. And when it comes to tobacco industry interference, we work a lot globally, and we attend every round of negotiations of the Conference of the Parties of the Framework Convention on Tobacco Control, the Tobacco Treaty. And every time it's at every Conference of the Parties, it's always the same story. Country after country states that tobacco industry interference is the main obstacle to achieving tobacco control goals at country level. And just recently also, just before the World Conference on Tobacco Control, ASH held an Endgame Summit, and we had all of participants provide input and questionnaires on what they thought was the biggest obstacle to end tobacco endgame. And again, tobacco industry interference was the main obstacle. So today you'll be hearing a little bit about ways in which the tobacco industry interferes with public health policy and ways you can counter those actions by the tobacco industry. So we'll have three great panelists today. If you have questions, you can use the Q&A option at the function at the bottom of the screen, and feel free to direct your questions to any of the speakers. So let's go straight to the first speaker, Traci Kennedy, who's the Midwest States Strategist at Americans for Nonsmokers Rights Foundation, who will give us a glimpse of what advocates experience and find at the local level when fighting for your right to smoke-free air. Traci, the floor is yours.
Thank you so much. Can I get a nod? You're seeing my slides, Nichelle or Annie? Yes? Good? Okay.
Yeah.
Great. Well, appreciate spending some time with you wherever you're joining from today. I am Traci Kennedy. I have been working with Americans for Nonsmokers Rights for the past decade. But I started my journey in this field as a youth advocate. And so I can't say enough about the importance of engaging youth. And I think one of the big things that continues to draw youth into our movement is taking on the tobacco industry, because I can vividly remember hearing about tobacco industry tactics for the first time during a Tar Wars presentation, which was this poster contest. And I just couldn't fathom this industry trying to come to me as a child to be their next potential customer. And that just incited something in me that led to this career. So just a full circle moment that I will say taking on the tobacco industry is just really the fire that keeps us going, because this work is challenging. Policy work is incredibly challenging, and a lot of the infrastructure that drives our work is under duress at the time. And so the industry, as we see in this tracker, does not rest. And in fact, sometimes when we leave a space, they step in and take it up. So let's all commit to renewing our fight against the tobacco industry today. And I'm going to talk a little bit about the history of the tobacco industry and their tactics, because that's something that we at Americans for Nonsmokers Rights with our colleagues have been calling out the industry for nearly 49 years, for almost 50 years. This is exactly what we've been doing, taking on big tobacco. And then I'm going to touch one moment on some of the things we've seen related to kind of the history of big tobacco during this legislative session for especially part-time legislatures, and then how to defend the ground we've gained. And Annie's going to dig into this even more. So it'll be a nice layering of topics. So something I find interesting is whenever I'm sensing tension or the push to compromise or a lack of political will to advance tobacco prevention policy and best practices, we can often trace that tension or opposition directly back to an industry tactic that was either a seed planted 3 decades ago or just a new phase of what the industry looks and feels like now. So much like when we talk about smoke-free air or secondhand smoke, Now we mean combusted commercial tobacco, we mean cigars, hookah, e-cigarettes, and marijuana. So the definition of smoke-free air and secondhand smoke has changed. Big tobacco, or the tobacco industry, has also shifted. So now big tobacco also is engaged in the e-cigarette market, obviously very heavily invested and influenced. They're also investing in smokeless products, heat not burn products, as well as the cannabis industry. So I think we have to really open our minds to exactly who the industry is and challenge our thinking. So some of these persistent myths are things that have come up consistently even in this last legislative session, for example, in the state of Rhode Island, we were working to close the loophole in their statewide law where all workplaces are required to be smoke-free, except you can still smoke in casinos on the casino gaming floor. And a compromise option was suggested or recommended of having a sort of smoking room or smoking area. The Philip Morris options program with smoking and non-smoking sections or smoking rooms is a very antiquated and dated idea that came back from progress we started 40 years ago on smoke-free restaurants. So this whole notion that some level of indoor smoking should be maintained in certain environments, especially entertainment environments, even the way we talk about hospitality workplaces. Hospitality workplaces are the largest employment sector where people remain exposed to secondhand smoke. Part of that is because the industry successfully tied this idea that these aren't workplaces. They're places adults go to enjoy themselves and have fun. It's this culture of enjoyment, and smoking is part of that culture. So they so successfully wove that fabric together that decision makers are perpetuating these myths without even knowing they came directly from the industry. Also investing in both scientific studies to discredit the harms of secondhand smoke and to come up with ventilation systems as a solution comes directly from the industry and industry documents. That smoke-free air means revenue loss, and also this concept that about the role of government, that policy work is an overstep of the government and businesses should be able to decide. All of these things are main opponents' talking points that distract from the real issue, is that smoking and secondhand smoke remain leading causes of preventable death and disease. Everyone has the right to breathe smoke-free air, and it's about people. That's what really matters, but the opposition is all coming from this history and legacy of myth perpetuation. What this looks like in legislative tactics, so youth access laws, things like creating separate product categories, so having e-cigarettes in a section of code or vapor products in a section of code, so then they are taxed differently and regulated differently. Preemption was a strategy first successfully deployed as we saw it from the tobacco industry. It was kind of designed by attorneys for attorneys. It's complicated, it's confusing to understand, but that is when a higher level of government restricts a lower level of government from being able to pass any type of law that appears in conflict. So when the tobacco industry saw local laws cropping up across the country that were shifting the norm on indoor smoking, they thought, we do not have the resources or the credibility at the local level. We cannot fight this fight. But our checkbooks and our influence go a lot further in the halls of the legislature. So that's really when we saw the popularity of preemption. So a statewide law that says no local government can pass an ordinance restricting where you can smoke. And this is still the law of the land in a handful of states, 10 to 12 states, including the state of Pennsylvania. You'll see probably in the materials later, Pennsylvania has the number one most tobacco industry lobbyists in the country. I don't think that's a coincidence. Now what we're seeing is that this kind of ongoing threat of rollbacks, it's a very vague approach to preemption that allows for things like cigar bars, but then also repeals local action and then reintroducing smoking of other products in public places like on-site marijuana consumption. The other legacy that the industry has committed to is the way they subvert regular legislative processes to avoid backlash. So if you're thinking about Schoolhouse Rock and how a bill becomes a law, there's differences in different political jurisdictions for how a bill becomes a law. But most of that is designed in a democracy to be open and receive feedback from people. This is why we support it. This is why we oppose it. But often the industry will sneak in either vague concepts or broad concepts that they attach to a bill. They'll attach it to a budget bill. Or, for example, this year in the state of Indiana, there was a very popular bill related to changing the alcoholic beverage code. And they knew the bill would pass through the legislature. So in the last 2 weeks, the cigar industry tagged an amendment on that would allow local municipalities to have cigar bars, even if they had a smoke-free law. So it was very difficult to participate in the conversation because there was no hearing. It had already gone through the committee process. So this a lot of times happens during the last minute rush at the end of session or around the holidays or lame duck. So this is what makes it so challenging when you see the sheer volume of industry lobbyists versus our movement, which tends to be less resource and have less presence in state capitals to watch when these tricky things happen. So I just like to bring this up. We've also gotten some distance that we do not trust the industry to regulate themselves. They are convicted racketeers. They stood in front of Congress, lied about the addictiveness and the nature of their products. They are the ultimate spin doctors because this is what they look like now. We know who they really are, convicted racketeers that cannot be trusted to regulate themselves. But now if you go to the Philip Morris International website, how many times does the word smoke free appear? I can count 6 times just right here. So they are touting their commitment to the smoke free movement to help win credibility, to distract, and to continue to grow their profit margin. So we know what they're up to. It's on us to let other people know that this is a nefarious act. So we talked a little bit about this. I kind of peppered in these details about legislative session. I work in 13 states, so some state legislatures are short and meet part-time, others meet year-round. But when you're an industry lobbyist, you always have that contract. So if it's an election year, you might be attending events, you might be hosting events or making political contributions. So what we saw in legislatures this year was efforts to preempt local smoke-free laws in Kentucky and Missouri. Really a lot of challenges on the rollback to allow cigar smoking indoors again. The statewide law in Indiana was changed. The local ordinance in Louisville was changed to go along with this cigar and bourbon culture. And now there's an effort to open a cigar lounge in the Detroit Wayne County Airport Terminal. There are only 4 airports in the country that currently allow any type of indoor smoking. So we really see this full court press and this whole drive about indoor smoking of cigars that really concerns us. And then these other kind of distracting other pieces of legislation are creating an e-cigarette registry bill for registering products, which is already a process that is underway with FDA, and I'm sure Annie will talk about this, and then creating these separate product categories for new products on the market, like the IQOS, the heat not burn. So they want, instead of defining it as a tobacco product, the industry wants a separate section of code so they're not treated the same. And then I talked about this kind of idea of Philip Morris smoking rooms maintaining some level of indoor smoking in places like casinos. I talked about this before, but also layering your resources with the tracker, the lobbyist tracker, then something like the Legacy Library from the University of California, San Francisco, where when I was hearing about these smoking rooms, I went to the Legacy Library and then looked up the accommodation policy. So we do have these resources to be able to directly tie the industry acts either with legislation or their past documents, which had to become public record. So kind of a webinar for another time. But if you have questions about Legacy Library, definitely check that out. And I just wanted to pull one example and just tell a brief story about this, and then I'll pass it on to the next speaker. So, this is what you're looking at when you do a state glimpse of the lobbyist tracker. And you might think to yourself, there has been a growth in the number. You might say, look, like last year there were 11, this year there's 16, but my home state is Missouri. And so you might say, oh, 16 lobbyists or lobbying firms, that doesn't seem like a lot. But one step further, who are these firms? Who else do they represent? And are they major power players in the state? Because often they are, and they might represent hospital groups, insurance groups, casinos. But when I started my career in 2006, I was a legislative intern in the Missouri Senate. And the tobacco industry lobbyist at the time was John Britton. And at that time, he was nearing retirement. But today, descendants of John Britton and his style are still very prominent in the Missouri Capitol. So he was one lobbyist. You can still smoke inside the state capitol in the state of Missouri in Jefferson City. You can smoke in the building, even though the city of Jefferson City is smoke-free. There are only 10 Capitol buildings in the country where you can still smoke. Missouri is one of them. John Britton, one lobbyist, was so effective and so successful that he passed a law in the state of Missouri that he was a designated smoking area. And as long as you were 20 feet from John Britton, anywhere in the Capitol, you could smoke a cigarette. So just when you look at this number, know that doesn't always tell the full story. He has since passed away, so I don't know how that would be grandfathered in, but it's just a reminder of how prolific and powerful these lobbyists can be at the statewide level. Before I close, I just want to say, we do have a role to respond. Call out the industry for who they are. That's our job. Call them out for their interference, call out their tactics, and keep the focus on people, telling people's stories, their exposure to secondhand smoke, because that's really what cuts through. So I'll welcome your questions later, and I will pass it back to Laurent.
Thank you, Traci, for those timely examples of what people are facing at the local level. So the next speaker is Annie Tegen, with Vice President at State Advocacy at the Campaign for Tobacco-Free Kids. And she will discuss how the tobacco industry is using lobbying, both lobbying and preemption tactics, to weaken the public health protections and ways you can fight them back. So some of it will be a little bit on what Traci presented. Annie, the floor is yours.
Talking to myself here. Hey, thank you so much. I'm going to see if I can get into slideshow mode here. Okay. Can you all see my slides?
You see your slide, but it's still, yeah, perfect. It's in presentation.
Okay. Okay, awesome. So hello, my name is Annie Tegen. I'm with Campaign for Tobacco-Free Kids. It's hard to follow Traci Kennedy. I really can't agree more with everything she said, especially the need to fight back. And one of the ways that we fight back is by using the resources such as the resource that ASH provides, the lobbying tracker software platform is really valuable. And for the exact reasons that Traci just said, we need to monitor and track and really then call out when the industry is being nefarious, as they typically are. So, all right, so I'm going to get started. So I have a little summary of sort of all of the ways that the industry is currently trying to increase their profit margin. As we know, that is the one and only goal of the tobacco industry. And so they're going to need new customers. And so they're constantly developing new products. They need to recruit young smokers and young e-cigarette users to use their products. And so they're, like Traci said, they're developing IQOS products, heat not burn products, Juul's sort of 2.0 with age verification system. They're trying everything they can to make sure that their products can still stay on the market. So as this slide is not a surprise to any of you, most likely, that they are using these, candy flavors to lure their young customers, and social media influencers. Certainly there's been an influx of celebrity endorsements. And folks my age may not really appreciate that, but certainly my children do. They're constantly being bombarded by social influence on their phones, on their little mini computers that they're looking at every day, on YouTube and TikTok and all those other things. So it's really effective. So another way, of course, that they are working to sort of change their overall appearance is an attempt to rebrand. And you've all seen sort of the Philip Morris's sort of attempt at a smoke-free generation, smoke-free future. And they're also providing grants to not only to fund research, and they put that in quotes, but they're directly funding community organizations, right? Like the Boys and Girls Club in your community, perhaps. All these are efforts to make them seem more socially responsible. But I just wanted a reminder to sort of level set us, to remember that the industry has one goal, and that is to make money. So they also have direct influence on legislation. They are working to ensure that there is no legislation that will prevent them from reaching that goal of making money. So one way that they do that is lobby up. And you've heard the term lawyering up, but they are lobbying up. Obviously, in 2024 to 2025, as Ash has reported, lobbying is up 24%. And that tells us something. That tells us that there's something, and that's in state legislatures. So that tells something that they are adding more lobbyists to their payroll because there's something going on. Either they know something we don't know, or they're afraid of what we're up to. But I think just the Juul lobbyists alone should tell you that there's certainly, perhaps they knew about the FDA's authorization of Juul menthol and tobacco flavored products, and they want to make sure that we don't stop those products from being sold at the state level. So they're lobbying up. They hide behind insiders and front groups. And that Traci alluded to that as well. Way back 50 years ago, they had the Smokers Rights group was formed, and they kind of hid behind those front groups. They funded those front groups, those community organizations, but really hid behind them because even back then, they knew that the tobacco industry coming forward to oppose legislation wasn't necessarily the smartest thing to do. So they needed a shell. And so they're still hiring former lawmakers, members of the clergy, political insiders, and they pay big bucks. They can pay a lot more than we can. So they're also funding, like I said, these community organizations, and it makes it more difficult when we go to those community organizations like the Boys and Girls Club. They're less likely to testify against the industry. So I call this AstroTurf. You've heard the term grassroots organizations, and this is the industry's way of kind of forming some sort of fake grassroots participation in communities. So they certainly are doing this to attempt to influence legislation. Finally, they're making direct campaign contributions, and this is no surprise to anyone either. You can look at this, and this is also tracked to see that the tobacco industry is generously funding primarily Republicans, but not always, legislators at the state level, and certainly they were Reynolds American was one of the largest funders of Trump's campaign, and so we certainly want to monitor that. We're seeing the results of that now. The tobacco industry also can attempt to halt and reverse progress that we've made. A lot of people that are here with us today in this group have worked tirelessly to pass local and state policies that impact public health. Flavor restrictions, smoke-free laws, tobacco taxes, increasing funding for state tobacco control programs and communications campaigns. So you fought for all those things. And the industry doesn't like any of those things. So they have worked at the state level to make sure that we can't take action at the local level. And I know Traci Kennedy spoke about preemption, and you're right, Traci, it is complicated. It's taken us kind of decades to kind of figure out what the best way is to explain it, but you did an excellent job. I just wanted to include this quote though from the tobacco industry, so you can really, I can get across how important preemption is to the tobacco industry. This is Tina Walls. This was decades ago, but she worked at Philip Morris, and she said, our goal is to see some form of preemption and accommodation legislation passed in all 50 states by next year. And she goes on to say that's their number one goal, and the fact that it will have local policies that are being passed around the country are having an adverse impact on their bottom line. So make no mistake, the industry is still out there trying to pass preemption laws at the state level so that we can't succeed at the local level. And they're also spending, obviously, millions at the congressional level and at state level to make sure that they kind of keep a tamper on state progress as well. So another way that they try to reverse and halt our progress is by repealing existing laws that we've already passed. We may work at the local level. For example, this photo is from a few years ago, but it shows a rowdy campaign in San Francisco where we had passed a flavored tobacco ordinance on the local level in the city and county of San Francisco. Some of you may remember Prop E. And we ended up, the tobacco industry put it on the ballot. We defeated it. They put it on the ballot again. We defeated it again. But it's just a reminder that when, that is certainly a strategy that the tobacco industry will take. Once a law passes, they'll try to repeal it. So we always fight back and win. Some examples of victories there below. There's currently a fight in Denver going on right now. And we'll be on the flavored tobacco ordinance will be on the ballot in November. And we expect to, we intend to win there as well with all of your help. Also litigation, of course, they're filing lawsuits left and right. Happy to chat about about the litigation that's going on both in Oregon and in Ohio and elsewhere. But certainly, again, we fight back. Campaign for Tobacco Free Kids is really proud to partner with all of you to write. Our legal team is expert in writing amicus briefs that we ask you all to sign on to, and certainly try to get involved and to support the protection of these laws whenever we can. I have just a few examples and then I'll close. This is an example from Los Angeles. The tobacco industry, we were working on a local campaign to end the sale of flavored tobacco and menthol cigarettes included in Los Angeles. This was several years ago. The industry, these are some examples of what the industry did. And I was there in person, and so I can tell you this is real. They had ads running nonstop. They used, unfortunately, Eric Garner's mother was sort of paid as an advocate for opposing these laws for a very good reason. She was upset because devastated at the loss of her son, and the tobacco industry kind of used that in their campaigning to say that it was the cause of cigarettes were involved because he was selling loosies, but certainly we know it was the police department. So they also, I have some photos here of some examples of individuals. This is an example of very sadly of AstroTurf, an example where they paid folks on the ground to sit in the city council chambers to protest in city councils, in the city council when they were testifying at the dais. And they also, we overheard, I was Phil Gardner, you can kind of see in one of these pictures, but I was sitting next to Dr. Gardner, and we could hear the people behind us saying, this is the easiest $50 I ever made. So make no mistake that the industry is planting folks in our local city council chambers. It's the best they can do because they certainly can't go in themselves with their sleek suits anymore and talk about how they want to keep making money. So they have used these front groups time and time and time again. And we have fought back the best way that we know how, and really invested authentically in the community. And that has worked in a lot of places. I will say, watching the tobacco industry lobbyists in real time in buildings like this is absolutely painful. If you ever get the opportunity, I encourage you to just go be a fly on the wall. If there's a local ordinance being argued, I heard some pretty awful things being said by the industry, and encouraging, there was someone that was there to advocate on our behalf, an African-American member of the clergy. There was the tobacco industry lobbyist went right up to them, and she kind of talked and tried to confuse him on the issue. And then by the end, he was kind of confused and didn't know which way which way he was supporting. And then his testimony got confusing. So, they'll really try anything on the individual level as well as the 30,000-foot view level to try to infiltrate our work. Another example is in Colorado, and this is a much happier story. The Denver flavored tobacco ban passed in December of last year. And the industry has now, as I mentioned, threatened to put that on the ballot. It is on the ballot for November of 2025. And we do intend to fight and win, but it's going to be a tough fight. But one of the things I wanted to point out here is that the industry, time and time again in Denver, tried to do the same thing that they did in Los Angeles, right? They tried to buy local advocates on the ground. They tried to, sort of pay local clergy and sponsor local events. And the wonderful thing is our team was already sponsoring these events and had already kind of inoculated local clergy. The community members had been fantastic in Denver. There's some really powerful folks on the ground in Denver that really, this issue is very important to them, and they fought hard. So they had already inoculated the community. So when the tobacco industry went out and tried to pay folks to be AstroTurf on their behalf, they said no. And so we see this as a really successful moment for us in beating the industry at the local level. So in short, we beat the industry, when we stick together. We beat the industry when we monitor and expose interference. And we can do that using ASH's tool. We beat the industry when we advocate at local levels. I can't reinforce that enough. You think about it this way. At the state level or at the federal level, it's really easy to buy power, right? They can buy people's connections to state legislators. They can buy lobbyist connections at the congressional level. But at the local level, they don't know, the folks at your mom and pop corner shop. They don't know, your local pastor, and they don't know your local teachers. So when we have those advocates step up authentically and speak up, it is the one thing that the industry does not have, and we should use it to our advantage as much as we can. Finally, we have to lift up and engage with our communities, and then protect our progress after we pass the laws. We can't give up. Once these laws are passed, we certainly have to make sure that they're enforced well so that they actually make a difference, and make sure that they're protected from legal challenges and ballot challenges. So I have one final note. I'm not sure if this is going to play, but I can give it a shot. One thing that's extremely important, adding to my comment about, the personal relationships. One thing that we've done is really share personal stories as a way to combat the industry. And I'm going to try to play this. Let me know if you can hear it. Can you hear it? You can't?
Not very.
Okay. Okay. I can send that along as a link later if you'd like to see it. But basically, personal stories had really have worked in local campaigns, again, because it's one thing that the industry does not have. They can pay for as many lobbyists as they want, but these faces on the screen here that you see are real individuals who care about their communities and really are fighting back. So I just wanted to take a beat here so you can look at these faces for a second, and just remind ourselves that this authentic engagement is our power, and it will beat the tobacco industry's power any day of the week. So that's it for me. Again, I'm with the Campaign for Tobacco-Free Kids. If you don't know our organization, I encourage you to take a peek at our website. And I also want you to know this is our regional team that we have on the ground. We have 7 regional advocacy directors that work at the state and local level. Contact me directly, and if you have a question, if you want help in your state fighting the industry, I'm more than happy to hook you up with our regional advocacy directors who can support you one-on-one. So that's it for me. Thanks for letting me be a part of this, Lauren.
Thank you, Annie, and thank you for reminding us that the passion that our advocates have is definitely a fantastic tool we have on our side, and also for reminding us of the double rhetoric that the industry plays. On one side, saying they want a smoke-free future, and then opposing, whether through ballot measures, litigation, every jurisdiction that passes tobacco control measures. I'll move on to the next speaker, and that's Nichelle Gray-Lkhagvadorj, who's the manager of engagement and special programs at ASH. Will present the U.S. tobacco lobbying and tracker and the lobbyist firm registration tracker, and present the data for 25, highlighting some of the key findings for this year and the changes since 24. As it's been pointed out already, it seems like we've seen an increase in lobbying from last year. Nichelle, the floor is yours.
Thank you, Laurent, and thank you to Traci and Annie for joining us today. I just want to take a step back and give a little bit of background on this project, because we were fortunate to work with a partner of ours, Doug Matheny, formerly with the Oklahoma Tobacco Research Center, who began this project years ago by tracking tobacco industry lobbying at the Oklahoma State Legislature. And through conversations with Doug and work collaborating with him, we were able to launch this tracker in 2021. Since then, we've tracked data through 2021, 2023, 2024, and now in 2025, this is the 4th edition of our tracker. So why do we track lobbyists and tobacco industry lobbyists? And as Traci and Annie mentioned, we want to highlight this issue, but as the WHO FCTC says, there is a fundamental and irreconcilable conflict between the tobacco industry's interests and public health policy interests. So what does that mean? As many of you know, the tobacco industry is aggressively promoting their products that cause preventable deaths in the U.S. The tobacco industry spends millions of dollars each year to influence laws, as we've seen through examples by our previous speakers. And we find the most effective tool for reducing tobacco use is public health policy. And unfortunately, the greatest barrier to that is tobacco industry interference. So we want to expose tobacco industry interference so to hopefully reduce its influence in public health. So to move on, the tracker objectives and our goals here are simple. We want to document and analyze tobacco industry lobbying efforts. We want to highlight the importance of data transparency, and we want to empower advocates with practical tools like this tracker. So just a brief background on some of the methodology and limitations before we get into the data. We looked for information that was obtained by visiting the lobbying registration websites for all 50 states and Washington, D.C. We also used public records to search those public records for tobacco companies, trade associations, front groups, retailers, for all currently registered lobbyists and lobbying firms. And a list of some of the keywords that we use in those searches can be found at the link on our slide. We also compiled identified all of the tobacco industry organizations, the names of their lobbyists, the firms that represented them. And because some of those lobbyists and firms also represent multiple clients, we tabulated the total registrations for all of those. There are some limitations to this project, namely that in several states, 13 that we could identify, and DC, lobbying firms are allowed to register rather than the individual lobbyists. So when you allow firms to register, it kind of hides the number of individuals that are actually working to represent that company. So it makes determining the true number a little bit difficult to figure out. And in terms of each state, they all have their own registration system, different rules, different formats, and different disclosure requirements. So there's really no nationwide blanket requirement for each state. They all have different practices, which can also make finding and obtaining this data a little bit tricky. So moving into this year's data, we found that there were 1,275 tobacco industry lobbyist or lobbying firm registrations this year, and that involved 1,140 distinct lobbyists or firms, which was a 24% over the figure in 2024. And as of July 1st, in reporting from Open Secrets, the industry has spent about $8.375 million on lobbying efforts. And nearly 3 in 4 of those tobacco industry lobbyists, or about 72%, are former government employees. And in addition to that, the tobacco industry is lobbying efforts took place in all 50 states as well as DC. And looking a little bit closer at the states now, we had 39 states that had more tobacco industry lobbying registrations this year than last. 8 states were a little less, and then 3 states remained the same. But again, we also noticed those top 10 states. Pennsylvania led the pack again with 92 registrations. Florida was up there, New Jersey, Tennessee, and several others that you'll see on the slide here. So who is doing the lobbying? We found that, or which companies do they represent? We found that vapor technology and the e-cigarette companies like Juul, they saw a huge increase this year, 358% just for vapor technology and 115% for Juul. PMI also saw an increase. And what we classify as other companies, just because we can't fit every company on our spreadsheets, but other companies would encompass brands like ITG, as well as some of those state trade associations, some of those smokers' rights groups that Annie was mentioning earlier in her presentation are encompassed in those other groups. We saw a big increase in those, especially the Vapors' Rights Associations. Reynolds Cigar Association and General Cigar also saw some steady increases. And then, as in years prior, Altria and Reynolds are the most widespread companies. They have a presence in almost every state. So I'm going to switch now to the site itself just to give a really quick overview of how to use the tool. I'm going to stop this share and go to the website. All right, so here is our 2025 tracker website and tracker tool. You'll notice that we have this interactive map here where you can zoom in on your particular state. Last year, we did update this tool to include tabs so that you can toggle between the years of data that we've been able to capture. In addition to that, you'll see some broad information as well as more detailed stats and figures on this page that you can use in for your tools and for your reporting. But we'll focus on a few states here just to give you an example of how to look up the information. You just click on a state on the map and you'll see a very brief overview of the total registrations for that particular year. If you want to compare that to a previous year, You can just click on that year that you're looking for, and you can click for a pop-up to show you a summary of that year's registration. If you click back on to the state, a pop-up, again, if you go to the pop-up, you can click the More tab, and that will take you to that individual state page. There you'll find, again, you have the spreadsheet of data where it names names. We also have the list of the companies they represent and each registration tabulated. Across the top, you'll see the totals for the registrations and the individuals involved. You can also, again, toggle between years to see and get a comparison for how things have changed over time. And then at the bottom of each one of these state pages, you'll find a source for this data, which will link you to where we were able to collect the data for that particular year. If you click on the image itself, you'll also be brought to a page where you can download a PDF of this data, so you can keep that for your records as well. And I will just navigate back to the main page quickly to show you that you can also use the sidebar to navigate to your state. So select Colorado here and show an example of a state that allows not only individual registrations, but firm registrations. So we have those broken out into two tables. Again, the totals will be at the top for you, and you can toggle between years to get a comparison for those. So I'll really quickly just show you some of the tools here that we have also on the side of the page. If you click this link here, you'll be led to some information on the companies that we included in our search. These are some of the main companies. Again, we don't list every single company here, but some of the main ones that we looked into. Then you can also click here to get a little bit more information on our research methods and limitations. This one is very useful for advocates. It's our social media tools and communication tools. So there's simple social media posts here, as well as graphics that advocates can use, as well as a link to the press release for this year's data. And finally, I think also just as important is this page. This is our feedback page, and we have two ways that you can do that. You can either take a survey and submit responses to the survey to provide feedback, or you can navigate to, you can email us at info@ash.org, and you can submit your feedback that way. So I'll just go back to my presentation now to wrap up real quickly. So just to wrap up everything that was said before and everything that we're trying to stress now, we encourage you to explore this tool, know who is lobbying, know who they're working for. We want you to use this data. We want you to reach out to your policymakers, to the media, use it in your meetings, use it to share with your networks, use it to build your coalitions. And then again, we encourage you to send your feedback. If you spot missing data, if you find discrepancies, we need that information from you to improve this tool and make it even better year after year. So please send us your information. And then finally, I would just request that everyone, stay tuned and stay engaged with us. Later this year, we'll be releasing our 2025 U.S. Tobacco Industry Interference Index, which talks about these lobbying efforts as well as other bad acts by the industry over the past 2 years. So I do encourage you to stay engaged and keep shining a light on industry bad acts. And with that, I will pass it back off to Laurent.
Thank you, Nichelle. Thank you for presenting this tool. So we have a lot of time for Q&A, so I want to go straight into the Q&A section, and we have quite a few on the chat, on the Q&A section, and I received a few others. So first, I'm going to compile the first set of questions, and And I think everybody's wondering, why is this increase now? Why is there an increase in, you reported a 24% increase in lobbying compared to just last year. And as you see this increase, is there a difference? You mentioned RWJ and Altria being the ones that were most represented, but do you see a difference between those big legacy companies and the newer companies that are there? And those, I'm assuming a lot of those are related to new products, vaping, and new nicotine delivery devices. And what do those want? Is it related to flavor legislation? What are their goals and objectives? So there's a few questions in one. I don't know who wants to go first.
I can just mention briefly, I kind of used some anecdotes from the field for how we're seeing this happen in real time. And so with our partners, sometimes we are able to hire contract lobbyists that are based in states where we don't have a consistent presence. But if we hire contract lobbyists, we commit to hiring someone who doesn't have any conflicts, who doesn't also represent, a tobacco industry client. It's becoming increasingly more difficult to find a lobbyist who doesn't have a conflict. And especially in the last session, we conducted interviews in multiple states with potential contract lobbyists who had been contacted by either an e-cigarette manufacturer or directly from PMI, specifically to advocate for new product regulations for these kind of separate product categories and carve outs. So I can't say that unequivocally that accounts for this influx in percentage, but in real time out in the field, that has been my experience, that it's really specific to introduction of these registry bills, in the pre-market review process, talking about some of the confusion about what's regulated by the FDA or products from China, which is largely just confusing, or this creating new product categories and definitions for things like heat not burn.
You said it was harder to get licensed or registered lobbyists who do not have a conflict of interest or who have not been contacted by the tobacco industry. That's an interesting
Very
point.
difficult.
Annie, do you have anything to add?
Yeah, we have the same issue in some states, Traci, so I totally agree. And I would say, two reasons popped up in my brain. One is that the industry is supporting so many registry bills in states, and I won't get into all the details about what the registry bills are, but there sort of forms a registry or a directory of items that can be sold in a state. And so these are generally supported and kind of put forward by the tobacco industry. It ends up being kind of a big tobacco, little tobacco fight. But if you can afford to kind of get your name on the list, then you can sell the product in the state. It ends up oftentimes coming in conflict with whatever's on that list may not be authorized by the federal government. So we have a research team in place that is dedicated to looking into these registry bills and finding out commonalities. But, there were over 24 registry bills introduced in states last year. And so that was a huge, huge influx, and we expect more of the same this year. And the second reason I think is that, it's possible that the FDA under this administration could authorize additional products. And so the industry, especially the e-cigarette industry, is wanting to make sure that those new products stay legal to be sold at the state level once they're authorized by the FDA. And a reminder that only 39 e-cigarette products have really been authorized by the FDA. So everything else technically is illegal to be sold in your markets that you see on your street corner.
Nichelle, do you have anything to add?
No, I totally agree with what Annie and Traci have said. I would just add on to what Annie said. Anytime there's a change in administration, the industry is going to jump on that and see that as an opportunity to push and influence policy making. So I think we're seeing, them do what they do best.
And is any of this lobbying in the US at the local level, any of it illegal? And that's my comments as does the MSA and or the DOJ lawsuit prohibit industry lobbying on any specific topics. Do you see any of it that's goes beyond their what they can do legally in the US, or is some of it, or is all of it legal?
There are, I'm not a lawyer, but there are some restrictions on what they can lobby for, you know, really related, I believe, related to the MSA, but I'll let someone else answer that if
I was
if
just
I'm
going to
wrong.
use another example of litigation. So when there was litigation with the industry and we signed on to litigate about their marketing practices, and you may have seen in US convenience stores, there had to be signs recently put up. And it took a decade to get that signage up, and it's already coming down. And that's not through like that ruling from the court has already expired. So I would just say, even when the lobbying tactics are restricted, I talked about this, they're still subverting the process either through litigation, or it's like they fight every step of the way. Another example would be kind of the resurgence of Juul coming back. So we have Juul going through a settlement process, kind of like master settlement agreement, and then they just got a market approval for their product. So they're like a zombie industry, right? They just keep coming back to life.
We have very little time, and so there's a comment about this is a very useful tool for political campaign, but is there a similar tool for political campaign contributions to know who is contributing and accepting funds? And Nichelle, I know that you've been working on that, so, and I see also Traci shaking her head. Nichelle, can you talk about this?
Yeah, and I'm sure Traci and Annie would say the same thing. Ash has used the data that's pulled from Open Secrets on tobacco industry campaign contributions. We don't want to reinvent the wheel with that wonderful resource. So I think that is a really good resource to use if you're looking into those details. And we do include that information in our U.S. Tobacco Industry Interference Index report that will come out later this year.
Great. So I'm conscious of time. We're like 2 minutes away. So I'm going to give each of the panelists an opportunity to say the last words. And Traci, I was inspired also by reminding us about the coming in from as a youth advocate and inspiring youth to engage in this area. But I was wondering, what do you think youth are they still outraged by the way the tobacco industry manipulates our society? Because especially people my generation, very often there's this perception that we've solved the tobacco problem. But do we need to create outrage among youth? And how do we do this to address tobacco industry interference?
I see, of course, my colleagues at Campaign for Tobacco-Free Kids as well, but I think that youth are very interested in social awareness and social causes, and kind of a lack of trust in corporations. And so I think calling out the industry for what they are as corporations, because we are seeing the renormalizing of some of these subversion tactics. So smoking in movies, smoking in popular culture, smoking in film, and smoking in different ways. So I think that it's the same story. Youth still have to, once they are aware of how they're being targeted by the industry, that's when they engage, because they want to be able to decide for themselves. So this is where it's upon us, I think, all of it, to use this information to empower people to follow the money and figure out what's going on here. And that's something I know young people get excited about.
Annie, and last words from you?
I would agree exactly with what Traci said. So not only to track it, but to expose it, and to expose it loudly whenever we can, is really important, and call it out for what it is. Sometimes if you've been doing this for a while, you just assume everyone knows what the industry is up to. But certainly your local city council member and your state legislators may not yet. So please tell them.
Nichelle?
Yes, ditto to everything that was said. We want this tool to empower advocates, reporters, policymakers to stay informed and be aware of who they're working with, so that we can improve public health.
Thank you, Nichelle. Well, thank you. I want to thank the panelists, and thank you all for joining us today. And well, stay tuned with Ash, where we have a set of webinars on a regular basis. And we look forward to seeing you again for our next webinars. So thank you, everyone. And thank you again to all the panelists and everyone for joining us today.
Thank you. Don't give up.
Thanks. Bye.